Hello, and welcome to Caring for Colorado's Youth Health and Wellbeing Part 2 webinar. Thank you for submitting your Part 1 application. It was amazing to learn more about all the incredible work supporting young people well-being across Colorado. We are so excited to review your full application, the second half of which you will be submitting in Part 2. The purpose of this webinar is to review each section of the Part 2 application, share how to schedule an office hour with your regional lead, and review next steps and key dates. To get started, first log in to the Flex portal with your username and password. Once you successfully logged into the portal, the screen should display the information pane to the left. Click on the draft request to access your current application. This screenshot shows what you, as the applicant, should see in your portal once you selected the draft proposal. You may have multiple drafts in your draft request, so make sure you are working off the correct proposal. The table of contents shows an overview of what is in the application. First, everything from organizational profile down to Part 1 narrative questions have already been completed during your Part 1 application. We do strongly recommend that every organization review their Part 1 application for accuracy. Please note, you can make some edits to some fields in your Part 1 application, should you need to update or correct anything. Sections 1 through 5 are the Part 2 application that you will be completing. To edit your application, click the Edit button, found at the top right hand of the screen. Important! Please save your work. The portal logs users out after 15 minutes, so save your work as you complete the application. The Save and Submit buttons are at the bottom right corner of the application. While you are entering information in your application, click Save to save and continue working on it. When you are finished with the application, click Save and Close. When you are done and ready to submit, you must first click Save and Close and then click the Submit button. You will not be able to edit your application after you click Submit. If you require immediate assistance and are unable to log into the portal or find your draft request, please contact our incredible grants management colleagues, Emma and Karen, by emailing grants@caringforcolorado.org, and they will make sure your technical questions are answered. Now, I'm going to pass this off to Lauren to share more about sections of Part 2 application.
Thanks, Gina. Okay, there are 5 sections in our Part 2 application: learning and assessment, narrative questions, financial information, demographics, and documentation. Pretty much everything in this webinar is available in written format in the following tools: the Part 2 application guide, demographics template, and the program project budget template if applicable. You can also use your own budget format. All of these are optional tools, but will likely help answer some questions that may arise as you're trying to complete the Part 2 application. Learning and assessment is the first of 5 sections that we will ask you to complete for the Part 2 application. The learning and assessment plan is based on the eligible strategies that you selected in your Part 1 application. For each eligible strategy that you selected, there will be 2 boxes for you to complete. The top box asks, what is your organization's approach to implementing the selected strategy? Give us a broad understanding of your approach. You can describe any framework, curriculum, staffing structure, values, or community engagement that you will use in the proposed work. Examples can be found in the appendix of the Part 2 application guide. The second box asks for 3 pieces: an objective, at least one subsequent outcome, and how you will measure progress toward that outcome. We'll get into more detail about objectives and outcomes in the next slide, but first I want to point out that you can add up to 3 objectives and subsequent outcomes for each strategy, but only 1 is required. If you are awarded funding, the information that you provided in this section will populate your required grant report. If you have any questions about this section or any section, philanthropy leads are available to provide guidance and support. Please note that if you find you do not want to move forward with every eligible strategy that you selected in the Part 1 application, you can scroll up to the Part 1 application responses section of the application and remove the strategies that you want to remove by selecting No. You must click Save for the strategies to be removed from the Learning and Assessment section. Okay, now we're going to go a bit deeper into that second box that asks for 3 pieces: an objective, a subsequent outcome, and methods used to collect data to measure progress. Eligible strategies take the place of goals and answer, what do we want to achieve? The eligible strategies are broad, general statements about what you wish to accomplish in the long term. They provide the framework for more specific objectives and outcomes. Remember, eligible strategies were set by Caring for Colorado and selected by you in the Part 1 application. Next, consider the objective. How are we going to achieve it? Objectives define the steps that you will take to achieve the goals. They should be specific, measurable, achievable, relevant, and time-bound. Finally, consider the outcome. How do we know that we've achieved it? Outcomes define the specific results you wish to accomplish. There should be at least one outcome associated with every objective. Part 2 of this question asks you to describe how you will collect data and measure progress. On the next slide, I'll walk you through an example. Okay, eligible strategy. What do we want to achieve? We want to deepen knowledge of adolescent development and parenting strategies that support young people's health and well-being. Reminder, again, these come from Caring for Colorado, and you selected them in your Part 1 application. Objective, how are we going to achieve it? We are going to facilitate 9 cohorts of Familias Unidas for 150 Latino youth ages 12 to 17 and their primary caregivers. 3 cohorts per year for 3 years. Outcomes, how will we know if we've achieved it? We have 2 outcomes listed here. Number 1, 90% of registered participants will graduate from the program by attending at least 80% of program sessions. Outcome number 2, 80% of graduates will demonstrate an increase from pre to post test on questions related to parental knowledge about adolescent development. It's not on the slide, but an example for answering part 2 of this question, describe any methods that you will use to collect data and measure progress, might be program attendance is tracked through an online platform, efforts to outcomes, and staff implement a pre and post test survey for every cohort. Now let's say that you selected 2 strategies that are achieved by the same program. The objective, or how you're going to achieve the strategies, can be the same, but the outcomes should tie back to the eligible strategy. This example is for an affinity-based youth program. They selected 2 eligible strategies: make good decisions and establish positive health behaviors, and contribute to others and their community. You'll see that they have the same objective because they're using the same program to work toward these eligible strategies or goals. Facilitate 6 15-week cohorts for high school age girls of color per year, 60 girls total, focused on addressing health disparities. But the outcomes are unique and tie back to the eligible strategy. One is showing increased knowledge of health factors impacting teens. Shows improving the ability of teens to make good decisions and establish positive health behaviors, which is the eligible strategy. Now let's move to the second eligible strategy selected, contribute to others and their community. You'll see that the objective is the same as the other because they're using the same program to achieve both strategies. But the outcome is different. The outcome looks at the percent of participants that contribute to a community project or initiative, which you'll see ties directly back to the eligible strategy. In sum, it's okay to use the same objective across strategies if the answer to the question, how will you achieve this strategy, is the same for more than one strategy. However, outcomes must be unique and directly tied to each eligible strategy. That's it for me. I'm going to pass it off to my colleague Sarah, who will take us through the next couple of sections.
Hi everyone, I'm Sarah. The next section contains 4 narrative questions. The first 3 are required and the last one is optional. The questions are: question 1, how does your approach to the proposed work align with the funding opportunities guiding principles? Highlight the specific alignment with our 5 guiding principles. Reminder, those are commitment to equity, guided by youth and community voice, prevention focused, culturally responsive, and informed by the science of adolescent development. Some of you addressed this in your Part 1 application. Feel free to use some of the same information or go deeper on a specific principle that is most critical to the success of your proposed work. Question 2, in what ways is your organization uniquely qualified to deliver the proposed work? Highlight your organization's assets and expertise. Describe specific experiences that have prepared your organization to successfully implement this work. Demonstrate how your organization builds trust and relationships with your community and other nonprofit partners. Question 3. What challenges might your organization face as you implement this work? Describe any internal or external issues or context that may affect your proposed work. Share how your organization plans to approach these challenges. Question number 4 is optional. What else would you like us to know? Please use this section to share any important information you would like us to consider with your application. Section 3 is financial information. You will notice in this section that you will be prompted to answer questions about your financial information. How you answer the questions will determine what financial documents you are required to attach. First, do you have audited financial statements? If you select yes, you will receive a prompt to upload those documents. If you select no, the system will ask if you have a 990 or 990EZ. Again, if you select yes, you will receive a prompt to upload those documents. If you select no, you will be asked to upload your internal statements from the most recently completed fiscal year. In the next part, select the end date of the financial period for the financial document referenced above. So if you uploaded audited financial statements for the calendar year ending June 30th, 2025, that is the date you select. If your organization uses GuideStar, please indicate the profile seal, and if not applicable, you can select NA in the drop-down menu. Section 4 is about the demographics of your organization and community served. Caring for Colorado collects demographics data to help us better understand our grant making and evaluate the effectiveness of our work in reflecting our guiding principles and advancing our mission. We recognize that requesting this information adds to the amount of time it takes to complete the application. We appreciate your willingness to share these details about your board, staff, and community served. We can assure you of 2 things. Number 1, answering these questions will not affect your eligibility for funding. And number 2, this information will stay confidential. If you do not collect demographic data, there is an option to say do not track if you do not collect the data we're asking you for. In the demographics section, you will be asked to provide demographic information for your board, your CEO or executive director, senior staff, and community served. We align these questions with the Candid GuideStar model for demographic data collection because it was created specifically for the mission-focused nonprofit sector. Specifically, we will ask you about the following demographics: race and ethnicity, gender identity, sexual orientation, and disability. As we mentioned before, we created a demographics template so that you can have all of your answers in one place and organized before you begin filling out the application in Flux. Important note: all demographic data questions, including those about community served, should reflect your entire organization, even if your proposed work focuses on a specific program and/or population. You will have the opportunity to explain how the data for your organization's community served differs from the proposed community served in this proposal, if that applies. If you're using a fiscal sponsor, the demographic data questions should represent the entity leading the work, not the fiscal sponsor organization. Additionally, only include data that your organization collects. Do not use general population data for the community served section. And now Steph is going to walk us through the last section.
This is section 5, documentation. This is the final section of the Part 2 application. Everyone is required to upload whichever financial document you specified in the financial section. It'll either be audited financial statements, 990, or internal statements from most recently completed fiscal year. Board of directors with titles and where they work, major contributors. Format doesn't really matter. We're just trying to understand where your other support is coming from. It's helpful for us to understand your revenue model. Key staff. List the names and titles of those responsible for leading, managing, and delivering the work, including your senior leadership team. Operating budget. If using fiscal sponsor, this should be the budget of the organization leading the work, not the fiscal sponsor. And lastly, year-to-date financial statements. Everyone also has the choice to upload an optional attachment. There's only one slot for optional attachments, so documents will need to be combined into one PDF. This is where you can include letters of support, stories from the community, annual reports, or any other optional items you would like to share. If you're applying for program, project, or capital funding, you will also be required to upload a proposal budget. You can use our optional template or whatever budget format you already have. Please note that applicants cannot delete attachments once they're uploaded. If you need to replace a document, please contact our grants management team at grants@caringforcolorado.org to delete them for you. Lastly, you'll see some letter prefixes next to the attachments in Flux. Please ignore them. They only matter to the back end of our system, so don't worry that you are missing any documents. Caring for Colorado divides the state geographically, so statewide leads can build an understanding of the unique regions across Colorado, and also so we can develop relationships with communities. This map shows the philanthropy lead assigned to each county. You should have received an email from your regional lead sharing a link where you can schedule a virtual office hour via Calendly. You can use this time to work through any specific questions you have about your application and to get any support on your learning and assessment plan. Here are a few next steps and reminders. Part 2 applications are due on February 5th before 5 p.m. Remember to use Google Chrome as your browser. The links to the Part 2 application guidance, demographic, and budget templates are included in Flux. Feel free to schedule an office hour with your regional philanthropy lead for support with your Part 2 application. For any technical questions, contact our grants management team, Emma or Karen. Thank you for all the work you do for young people and families. We know this is an incredibly busy season for nonprofits and families, and we hope you're able to get some well-deserved rest and rejuvenation. Have a wonderful holiday season, and don't hesitate to reach out if you need any support submitting your application.